Corla. And I'm grateful for the opportunity to speak briefly on the motion. I want to commend Sinn Féin for bringing it forward this afternoon. And of course it follows the news that over 700,000 people are on health waiting lists for treatment and assessment. The National Treatment Fund's figures, of course, from May 2018 represent an increase, Minister, of 6,200 on the April 2018 figures, and there's been a jump of 4,300 to 511,904 people awaiting initial assessment by consulting following a GP referral. More than 147,000 people, of course, have been waiting for more than a year for an outpatient appointment, and almost 80,000 have been waiting for more than 18 months. Almost 79,000 are on inpatient waiting lists, and almost 6,000 of these have been waiting for more than 18 months. These are really appalling figures, shameful figures. And I mean, it was laughable and disgusting this morning listening to Taoiseach Varadkar responding to Deputy Doherty, when Deputy Doherty rightly took him to task about the pathetic figures in the summary economic statement, which indicates that the government has precisely no plans whatsoever to do anything about these horrendous statistics. Of course, the health service in particular has been decimated over the decade of austerity, in which Taoiseach Varadkar played a crucial part by voting for the blanket bank guarantee, by allying with Fianna Fáil, and down through the decade, disgraceful decade, being prepared to allow people to suffer, particularly in relation to health and housing. I meet families, like other deputies have said, desperate for early interventions, assessments for children somewhere on the who may be on the autistic spectrum. I meet people who are actually in pain, like yourself probably can, Corla, and who are waiting treatment for areas like cataracts, knee and hip replacement, people waiting home help hours and home help packages, and siblings and children desperately trying to support elderly relatives in their 80s and early 90s who are not getting the supports from the Minister and from the State. I've of course long been calling for increased resources for our health services, along with improved accountability for those in management. But the hard-working nurses and staff on the front line of service delivery are simply not appreciated or remunerated, of course, sufficiently, and it's unsurprising that there is a recruitment and retention crisis in the health sector in this country. Galway University Hospital is experiencing the largest waiting list at almost 40,000, but the matter in Dublin, our hospital, is not far behind that at almost 39,000 on waiting lists, and of course we've just over 36,000 in Waterford University. And appallingly, of course, there may be no consultant psychiatric services for children in Waterford and Wexford from next month in the South East Child and Adolescent Mental Health Services in the CAMS. So from question after question, as you know, to the Minister for Health, we keep getting back very distressing news about waiting lists in this area and in that area of where urgent treatment is needed. Indeed, it was only yesterday that we learned there are almost 10,300 children waiting for more than 18 months to see specialists, and in total there are almost 54,500 children awaiting appointments with specialists, including for orthopaedic care and cardiac care. And last year we were all shocked and utterly devastated to watch the Prime Time Investigates, I think, Living on the List expose in February of 2017, and yet here we still have a long time later in 2018 children with spinal scoliosis still awaiting treatment. And the motion, of course, before us rightly references the Euro Health Consumer Index 2017, which rated Ireland worst for hospital waiting lists across Europe. And the Trolley Watch figures, again by the Irish Nurses and Midwives, of course, again in May, show that 9,091 people were waiting for inpatient beds. So as we were preparing, for Budget 2019, and we get another chance this evening, I think, to talk about the summary economic statement, I hope that these ministers, led by Taoiseach Varadkar, at long last are working on some measures to begin, as my colleague has said, the implementation of the Sláintecare report, because, as I said, the stats that the Sinn Féin motion has revealed here once again tonight, they are utterly shameful, and we have to take action to remedy them. Thanks, Can.